I'm Ron Kim. I am reporting to you from my district in Flushing. We are in the middle of starting our budget process. The executive, as required by the state constitution, issued her initial budget proposal this week, and the legislative body now has a few weeks to review and respond with our respective one house resolutions, our versions, and our counter budget to the executive. And then we have till April 1st between the executive, the legislature to make amendments and come to a final agreement to pass our New York State budget. Today, I want to just focus on an area that the governor or our leadership has not brought to the table yet, but it's critically important that we start having early conversations about how to pay and finance long term care in the state of New York and make sure that we have a system that works for our most vulnerable members. The Center for an Urban Future recently uh, issued a report on January this month about the crisis around older adults. I'm going to just read a couple of paragraphs. Again, this is the nycfuture.org. You can find this report. Keeping pace with an aging New York State. New York State's older adult population is booming with more residents ages 65 and above, nearly 3.5 million than the entire population of 21 states. An expanding share of the state's older adults are immigrants and people of color. Alarmingly, older New Yorkers living below the poverty line increased by 37% of the past decade. This is an article that was done, research done by Jonathan Bowles, Eli Vorkin, and Charles Shaviro. Uh, let me just read some of the other data that they've covered. Between 2011 and 2021, the state's 65 and over population increased by 815,000 and 166 people, 30.6%, from 2,662,499 to 3,477,665 people. More than half of this growth occurred outside of New York City. Long Island alone has 113,670 more older adults than a decade ago, and the list goes on and on. And the point is that this is beyond a crisis moment. Yes, we passed some laws to create a couple of study task forces, long-term care task force. We passed money. We passed the bill and put some money behind the master plan for aging, and institutionally, administratively, these experts have started to meet, come up with a sound and forward-thinking plan as we move forward. But in the interim, we need to put as big of a band-aid as possible before we fix this aging crisis in the state and in this country. When we get this right in New York, it could be a model for the rest of the country, if not the entire world, because the New York has the resources, the funding, and the wealth to actually protect every vulnerable older adult, and some more. But the reason why we're failing, and the reason why every year some of these facilities, the living, assisted living and nursing home facilities, rank at the bottom. New York and New Jersey ranks at the bottom of the entire country, is because we have allowed private sector predatory investors take over this entire industry while undercutting surgically for many decades the administrative ability to oversee, regulate, and check the industry from making sure that they're not prioritizing maximum profits over people's lives. But the practice has, for decades now, been normalized that people are cutting corners. Even when we fought so hard to institute safe staffing measures, our own administration that went through two different health commissioners in one administration went to testify to undercut the rules to get rid of the fines that would be imposed if nursing homes are being negligent and not following safe staffing regulations. They're in the process of undercutting even more of the safe staffing laws because the industry, with their heavy lobbying and influence, are essentially just controlling the Department of Health. And that's where I think this conversation must start. We all know, after being in public service in the healthcare space, that our Department of Health has been a revolving door and have had many commissioners come in and come out and not build the administrative capacity to actually regulate and actually administer programs in times of emergencies and beyond. What we've done ever since the first Cuomo, Mario Cuomo, is normalize the outsourcing and contracting out of everything that we do in healthcare through a nonprofit called Health Research Institute, the shadow arm of the Department of Health that really runs the show for the DOH. Because more than 50 up to 60% of the high level commissioners, deputy commissioners, draw a second income from HRI, the nonprofit that has industry donors come in and they're supporting this nonprofit. This is a clear conflict of interest where when you're in a position to administer care and administer the oversight of industries that are prioritizing profits over people's lives, your interests are conflicted because you're drawing a second income from a nonprofit that accepts donations from special interest groups. Again, we've designed a system like this to get away with to mistreating older adults, disabled New Yorkers, to see these elderly and older adults as dollar signs where the system can, where the industry can extract and exploit them for as maximum dollars as possible without actually taking care of them. And unless we fix this, unless we have the courage to say enough is enough, to properly fund the measures, the programs that can actually be a counter a service and an advocate for the families, and then they can actually understand what families and workers need and prioritize policies and budgets to protect those people that are suffering the most and center solutions around the actual residents, the older adults, the consumers, and the workers. We're never going to actually have a functioning long-term care system in the state. There's a couple things that we can focus on immediately. There is a program called the Long-Term Care Ombudsman Program, LTCOP. This is a program that was originally brought to us by the federal government under the aegis of the Older Americans Act, and some of the framers of LTCOP at the federal level wanted as much independence for this program to make sure that they had the authority to go after the bad nursing home operators and assisted living and other facilities that are in the business of taking care of elderly and disabled people. Unfortunately, due to the heavy influence of the industry, LTCOP program has been systemically undercut, undermined, and left behind the scene, neutralized to make sure that they don't interfere with the Department of Health, the Medicaid, system and the industry that are making billions and billions of dollars of a broken system. LTCOP, if they do their job properly, they would make sure that the Department of Health is held accountable to deliver the oversight and accountability of these facilities. That's why LTCOP have been sidelined for so many years. So we need to properly fund the long-term care ombudsman program, and perhaps explore the possibility of putting the LTCOP program somewhere else where there isn't an ability for the executive office or Department of Health to suppress the work of the program of long-term care ombudsman program. So that's the first thing that we can do to make sure that we have balance and accountability for long-term care facilities. Secondly, there's a number of proposals that we're exploring, and there will be more to come around public financing for long-term care to make sure that people who are waiting for services for years are met, those needs are met, and make sure that we have a system that can finance long-term care without making sure these people do not fall into the cracks. That's something that I'll be discussing in the near future. But I want to make sure that as we move forward in the budgetary process, that we don't forget about our older adults. We don't reduce them, and we don't make them feel like it's their duty to die, because that's the culture that we have normalized during COVID. We've lost 16,000 people in long-term facilities. There's so much trauma in our families. We fought very hard to pass some legislations in the Senate and the Assembly, for example, the Grieving Families Act, to strengthen the rights of our most vulnerable people, older adults, to the workers that work in these facilities. But it was recently vetoed by Governor Hochul, and I hope the leadership will send it right back at her, pass it again as it is, and this time not give her a chance to veto, and if she does, give us plenty of time to override this measure, because the people of New York deserve a law that is designed to strengthen their rights as patients and consumers. There's a lot more to come, but for now, let's make sure that we don't lose focus and lose sight of our older adults and elderly that have been left behind for the last few years. Thank you.